club members and guests. The title of my speech is High-Risk Insurance Falls Behind Predictions and Purpose. For all we know, the Obama health care reform has high-risk insurance. The plan's relative lack of popularity reflected growing pains. They predicted that enrollment would grow swiftly as more people found out that they exist. Now, first of all, what is high-risk health insurance? False. The definition states that it is a state program that offers health insurance to residents who are considered uninsurable and unable to buy coverage in the individual market. Typically, people are considered uninsurable if they have been turned down, charged substantially with higher premiums, or if they have been offered higher coverage with an elimination rider. In the United States, there were 34 states which were ranked in high-risk pool programs. The number one state with the high-risk pool programs is Minnesota. In 1976, the enrollment was 27,386. And number two is the Texas, which was in 1998, it was 26,908. Number three is the Wisconsin. In 1981, 16,284. And Illinois, in 1989, it was 15,682. The sources was, I gathered these facts from data collections and analysis by Elisa Banquet and Karen Pollitz, the Health Policy Institute, Georgetown University. According to the Washington Post, staff writer by Amy Goldstein, Thursday, February 10, 2011, 9:35 p.m. More Americans had been signing up for special health plans designed for people with medical problems that caused them to be spurned by insurance industry, according to the new government figures. But enrollment continues to lag significantly behind original predictions. The number of people who have bought the plans, known as high-risk pools, has increased from slightly fewer than 8,000 nationwide as of early November to nearly 12,500 as of the beginning of this month, according to figures released Thursday by federal health officials. Several months ago, the special insurance pools became one of the earliest facets of the new health care law to take effect. They are intended as a temporary coping mechanism for people with medical conditions that traditional insurance companies do not want to cover. The program is temporary because starting in 2014, the law will forbid insurers to reject customers based on whether they are healthy or sick. The law gives states the choice of starting an insurance plan for pre-existing conditions to letting their residents enter a federal plan. 27 states have started their own. The new high-risk pool has attracted the greatest number of participants in Pennsylvania, where nearly 2,050 people have signed up, about 400 more than 3 months earlier. In Washington area, the district, and Maryland have created their own pools with 10 and 145 customers, respectively. Virginia, relying on the federal pool, has 204 participants. Health and Human Service officials released the updated enrollment figures on the same day that the agency's top officials in charge of Medicare, the public insurance programs for older Americans, made the first appearance before House Committee. In conclusion, the Patient Protection and Affordable Care Act signed by President Obama on March 23, 2010 creates a temporary national risk pool to provide health coverage to people with existing medical conditions who have been uninsured. Shouldn't people take advantage of this opportunity? I believe that people should take advantage of this because it will be helpful to, especially for those who have existing conditions. And thank you.